students. So in this class we'll be going to discuss one more concept. It's very important concept, that is mechanism of urine formation. We all know that our blood, it has to filter at the kidneys. So in each kidney 1.3 to 1.8 millions of microscopic structures are present. So they are nothing but nephrons. So they are also called as uriniferous tubules. Why? Because the urine, it has to be produced in that uriniferous tubules. So now we'll get into the topic, mechanism of urine formation. So this urine, it has to formed in the nephron, just I told to you. So this urine formation, it has to involve four main stages. So first one, glomerular filtration. Second one, tubular reabsorption. So next, tubular secretion and concentration of urine formation. So these are the four major steps. Now we discuss about the first step, glomerular filtration. The name itself, it has to be indicating that. So filtration, it has to occur inside the glomerulus. So you all know that to the kidney, renal artery, it has to bring the blood. So inside to the glomerulus, the blood, it has to flow through afferent arteriole. Entering through afferent arteriole. It has to be coming out through afferent arteriole. So if you are seeing this, the size of this afferent and efferent arterioles, the afferent arteriole, it has to become narrow. So because of this narrowness, pressure, it has to created inside the glomerulus. So this filtration, it has to be pressurized filtration, which is also called as ultrafiltration. It is occurring in the glomerulus. That's why it is called as glomerular filtration. In this filtration, so the blood, from the blood, the waste materials, it has to be comes out. Along with the waste materials, so nutrient molecules, glucose, amino acids, vitamins, salts, all the useful materials, it also comes out. So that the entire filtrate, it has to be entered into the Bowman's capsule, and it has to be moving to the renal tubule, the first part, PCT. So the filtrate, we are calling it as primary urine. So it is this primary urine, it is having lot of useful materials. So how these useful materials, it has to be entering into the again blood capillaries. Now we will be going to see that. In the tubular reabsorption from the primary urine, the useful content, it has to be reabsorbed. It will be reabsorbed into the pericapillary network. We all know that the entire renal tubule, it has to covered with a pericapillary network. So here if you see that now the primary urine, it has to be passing through this PCT, proximal convoluted tube. So when it is passing through this PCT, so the useful substances, it has to be reabsorbed into the blood capillaries. So what it has to going to reabsorb here? So 75% of water, it is reabsorbed at the PCT level. And so not only water, so glucose, amino acids, vitamin C, and many salts like potassium, calcium, sodium, and chloride ions. So what not? So all the useful content, it will be reabsorbed into the PCT. So now next we have to be move on to the tubular secretion. After reabsorption, the primary urine, it has to get filtered, and it will be passing through loop of Henle and DCT, distal convoluted tube. It is an active secretion process from the blood capillaries. So the waste material, still it has to be some remnants. Waste materials, it has to secreted into the urinary tubule. So here you observe that tubular secretion takes place from capillaries to renal tubule. Capillaries to renal tubule. So whatever the components, it has to be secreted in the sense urea, uric acid, creatinine, and excess of salts like potassium, sodium, and hydrogen ions. So these components, they will be secreted into the nephron. So all these things, it has to be involving in the concentration of urine formation. After the secretion, so by this absorption and secretion process, there has to be involving in the concentration of urine formation. At the PCT level itself, so 75% of water it has to be reabsorbed. By that, so the primary urine, the renal filtrate, it has to be concentrated by losing the water. At the same time, from the entire loop of Henle, 10% of water it has to be comes out by the process of osmosis. Like this, the water content it has to be coming out from the primary urine. At the same way, so in the secretion process also, by adding some more components to that primary urine, it has to get concentrated. Another further concentration it has to done at the collecting duct. So in the collecting duct, with the help of a hormone called as vasopressin, with the help of vasopressin, further concentration it has to be formed. So with the help of this vasopressin, the urine it has to be concentrated, and concentrated urine it has to be going to formed. Like this, in this 4 steps, the urine it has to going to formed. The concentrated urine it has to be going to formed. Thank you. Please like the video, and if you like it, please share the video. Thank you. Please subscribe.